Now, as you're going through this technique, remember the glutes are quite sensitive. So if you do press and the glutes tighten up, back up, start from square one. Kneading, some gentle rubbing, maybe some pushing, because you've stimulated the nervous system. We have to essentially calm the nervous system down again. So you need to make sure you go nice and slow and easy. Okay. You could use one finger meditation technique. I don't find it very useful on the glutes. I find it a little bit more beneficial on the lower legs, on the back, maybe on the arms. But the glutes, there's too much tissue to go through. And it could be quite hard on the thumb to press that deep. Okay, so then we could shift down into the leg. The same thing will be a rolling technique. When you're practicing here, you can practice with both hands. Go down with one hand, go up with the other hand, shifting back and forth. And the movement, again, is coming from my legs. Or if you're uncomfortable with both hands and you want to just practice with one, no problem. You just start in whatever spot you want to, move up the meridian, slide back down. For a pressing technique, a kneading technique, I'll use the palm of my hand. I can also knead quite quickly and relatively deep. I'm not getting too terribly painful here. You're okay? Good. Remember, with kneading technique, we're always paying attention to what we feel under our hands. We're starting to find that there's a lot more tension on the medial side of the hamstrings. That's going to be semitendinosus, semimembranosus. I don't feel nearly as much tension on the biceps femoris. Of course, the UB meridian goes right down the middle, in between those two, for the precise meridian. But as we know with Tuina and Acupressure, the whole idea is the meridians and the sinew channels. The sinew channel of the urinary bladder meridian encompasses both of the hamstrings. So you're conceptualizing these meridians being these super precise pencil-thin lines. And yeah, that's true, that's where the points reside. But in practicality, it's not just that. It's the precise meridian and the sinew channel, which is quite a bit larger. So here I could maybe do a one-finger meditation technique. I'm going to go on to UB, what's that, 36? 36, yeah. So UB 36 is right up at the ischial tuberosity. So I'm just using the pads of my fingers with a pressing technique. You see I'm moving my whole body instead of just my fingers. I could use my fingers, but I'm going to wear out my wrists, I'll wear out my shoulders, right? So I'll use my whole body. You're doing okay? Now, you can try and press and then go into suppressing with your fingertips. But what I've found is on the legs, it's quite difficult. It requires a lot of pressure. So instead, I'm going to use my elbow. So I'll use my left elbow in this case, face the bottom of the table, take my olecranon, go down the leg, and push up into the ischial tuberosity. Okay? Yep. Now once I've felt that ischial tuberosity, I can flex my elbow. This hand is going to stabilize. Make sure my shoulder's nice and low, and press in. How you doing?
Yep.
Not too painful?
Nope. Probably right there.
Yeah. So that's quite a bit of force. I don't think I could apply that much more force without starting to hurt myself, so I'm not going to. I'll relax. And remember, that's the case, is when you're applying pressure, go until you're comfortable. And if they need more pressure, and you could give them more pressure, but you've got to hurt your body to do so, don't do it. It's not worth it, right? You've got a long career ahead of you, and you don't want to wear yourself out because somebody needs more pressure. Need more pressure? Maybe they find a different therapist, or you spend a bit more time working into that point, right? So if I just maybe need a bit more, wake up the nervous system a little bit in that region, all of a sudden we could find that I could spend less effort. You okay there? Mm-hmm. So don't wear yourself out. Never push to the point where you're shaking and you're struggling and you're holding your breath. It's not worth it. You can get the same effect with being a little bit more patient, right? Okay. So moving down the leg, like going to UB 37. It's a really good point for low back pain. Okay? Do kneading, go into pressing, suppressing, the same techniques we've done many times. You could use the tips of my fingers or my elbow. Again, I would not suggest using your thumbs. It's going to be too much pressure required on the back of the legs. Okay. Now I'm going to bring the sheet up because I want to show something very specific. Okay, you okay with that, Sarah? Yeah. All right. Okay, so we're going to move on to UB40 and then we'll practice. I want to spend a bit of time focusing on UB40. So you know the precise location of UB40, right? We find the two tendons of the hamstrings, the medial and lateral side, and we've got the popliteal crease. technically speaking, UB40 is in the very center of the popliteal crease. So we could press here, but when we're doing Tuina, when we're doing a pressing technique, we actually want to be about half a cun or half a thumb width inferior to it. If we press directly into that popliteal crease, we're going to get a pain response before we get any type of therapeutic effect, because it hurts. But if we move down just a little bit, we're still stimulating the appropriate meridian. We're close enough to the point, and we could actually get to the depth required to create a therapeutic response, right? So you don't just dig in to that point. I'm going to do the same thing I always do, leading. There's no bolster. Sometimes I'll just hold onto the foot like this. That brings the muscle into a slightly more laxed position, right? So I'll do some kneading. You okay?
It's tight, but it doesn't
It's
hurt.
tight, yeah. Let's see. You can bring your feet up. Okay, there you go. There, that's a little better. Now, in this case, I'm going to go from pressing into suppressing, and I'll use the pads of my thumbs because I don't need a lot of pressure, as opposed to the rest of the posterior leg where we needed quite a bit of pressure. So I'll just do rhythmic pressing, or I could do static pressing with the pads. I could do static pressing with the palm, with my fingers. Okay? And I can quite clearly feel a very tight muscle, and that's popliteus. So I'm going to shift from pressing into suppressing. So to do so, facing the head of the table, I'm going to find that point with my thumbs. Again, I could use my fingers, but because it's relatively light pressure, I'm okay to use my thumbs. Get on top of the point, and lower my weight in.
Oh, yeah.
Oh yeah. This is sensitive on just about everybody. I don't know how many people aren't sensitive here. So if you get suppressing technique done here and you're like, oh, it's fine, let me know. Because you're 1 in a million. Doing okay still?
Okay.
And we can back up and do a bit of kneading.
This is ask point or just
This is UB40. So
Oh.
just inferior to
Yeah.
Really good for low back pain. Okay for hip pain, not the best for hip pain, more for low back pain. We could do the same thing with reinforced fingers. Get on top of the point and press into it.
Yeah.
Okay. And then kneading. Okay. So superficial, deep, superficial. We've gone superficial to deep all the way through this entire region. So I'm going to back up and go superficial. So again, I'll do my rolling technique all the way up. In this case, I could go all the way through the glutes. It's down on the other side. Go from the glutes down. Oh, I didn't show GB30. No problem. Okay. So backing up again for a second, going into our deeper techniques, so I could show you GB30. So we know how to find it. We find the coccyx, just slightly superior from the coccyx of the greater trochanter, and it's the lateral third. That's going to be directly over the piriformis. So once I've found it, a lot of people, you don't need that much pressure. How you doing?
Mm-hmm.
Yeah, you feel it?
Yeah.
So you don't need a lot of pressure on GB30 on some people. On others, you could lean in with your elbow and a red face, and you're not going to get to the depth. So I'll typically start with my fingers, do some pressing, and then into suppressing. Yeah? Or, again, you could use that elbow. So finding the point, I've got my finger on the point. My elbow then replaces my finger with the tip of my elbow. I'm not pressing yet. Extend the elbow, lean in. How you doing?
Good.
Okay. If I want more pressure, bend the elbow. You're okay? Breathing through it?
Yep.
Good. So it's the same type of technique as we did with the UB meridian. Now, as I come out of this technique, I'll just extend my elbow and take the pressure off. So you reverse that technique and then go into kneading. Okay. Any questions?
so for the low leg just GB 30, 36, 30, 36, 40, just 3 points?
Well, yes, 3 specific points plus working on the entire sinew channel and meridian.
Oh, okay.
Yeah, and then we'll do the lower leg demonstration next.
Okay.
And do you want us focusing like on like medial leg rather than like lateral Like up here?
No,
Or
you'll
is
focus
that-
on wherever there's tension.
Okay.
So for you, there was more
specifically-
tension on the medial side of the hamstrings, right? But the sinew channel itself runs down the entire posterior leg. So
Yeah.
somebody else might be a little bit more on the biceps
Okay.
or on the lateral side.
I wanted to say.
Same question, yeah.
Like adductors.
Yeah, so working on the adductors themselves, it's more going to be liver meridian. And we do that in a slightly different position.
Last class, you pay more attention on the margin of the iliacs.
Yep.
So why? Is that the more tricking point or something else?
Yeah, a lot of Ashi points.
Oh,
Mhm.
because of glue major?
Glute,
Glue
glute
max.